Welcome to this episode of Patient Voices in HIV Management, a CE podcast series. If you are seeking continuing education credit, please review the disclosures and the requirements for successful completion of the activity prior to listening to the podcast. A link is found in the show notes that can direct you to this information. After listening to the podcast, please go to practicepointcme.com to complete the post-test and evaluation to receive continuing education credit. Joining us in this episode is Dr. William Short and his patient, a 40-year-old male with HIV, hypertension, and nephrotic syndrome.
Hello and welcome. My name is Bill Short. I'm an associate professor of medicine in the Division of Infectious Diseases at the Perelman School of Medicine at the University of Pennsylvania in Philadelphia. And I'm joined here today with one of my long-term patients. Welcome.
Welcome. Thank you.
I want to get started. I'm going to take you back. So I've been taking care of him. I had to go back and look, but it's been since May of 2013. So do you remember back in May of 2013 when you came to see me after having seen your primary care doctor? Do you remember sort of what played out in the room at that time?
Yes, actually. I went to my primary doctor for a routine physical and normally do annual blood work. I got a call back, hey, can you come back into the office? And there was an issue with the blood work. And they were like, well, we're going to test you again because we think we got some false positives on a HIV, diagnosis or so we ran it again, and I think she may have run it maybe once or twice, or maybe even a third time, and then sent me to see you because they didn't know sort of how to handle either the conversation, or they actually told me that these are probably false positives. And so I came to you thinking, hey, there's that 1% chance or whatever that this is wrong, or I have a certain blood type that I know this can't be right. He was like, no. This is actually correct.
And I remember, I think one of the other points, I remember your response, and we'll get to that in a second, but I think one of the things that, I remember you never went back to see her. And so your trust in her, was really shattered because I felt like you had this, she's telling you one thing, I did the screening twice, this is a false positive, but why don't you go see Dr. Short and he'll tell you why this is a false positive. And when I look at it, I'm like, no, let me explain to you why this is real, and then where are our next steps. And I think it was her misunderstanding of how to read the testing. I think this is really important to understand for anyone. When you order a test, any provider, when you order a test, you really need to understand what you're ordering, what the results are going to be, how to interpret those results, because you're going to give this to someone in front of you who's relying on you, and they've established this rapport with you and trust. And now you're going to give them a response that may not be true. At that time, did you consider yourself to be at risk for HIV?
No. No.
Why did you say that you wouldn't consider yourself at risk?
Because even having unprotected sex, I never thought that would be. I guess naivety plays a part in it, right? Because you automatically assume that it's not going to be you; it's going to be someone else. Whether having anal sex unprotected, you just don't think that it's going to be you, that is just playing around, or just enjoying sex in different ways. So
one of the hardest things after you learn your diagnosis, right? So you have to then hear it, accept it, say, oh my God, this is a reality. Do you want to explain, and I know this is going to be a touchy subject, so, I understand if you don't want to do it, what it was like, because you had to go home and tell your wife, because that's often scary for a lot of individuals.
And I think, one, we had small kids at the time that were not mine biologically, but the next fear after me of even talking to my wife at the time was, wow, does she have it? What does this mean for her? No longer was it about me, but it was about her. And she was able to take it and was like, we'll still get through this together. but that conversation was hard, but it needed to be had.
But, you also did not come in with, this was your only problem. And I think you added a little bit of complexity to the situation because you had, really significant high blood pressure. Your cholesterol was high. And then on top of that, you had kidney disease. And also, I had to make sure, this was coordination of care because not only I had to make sure one, I know your HIV I could handle, but we got to get that blood pressure under control, your cholesterol under control. And I had to pick a regimen for you and help and sort of discuss with you, here are the things we need to think about. And I can remember very well one of the new regimens I put you on, it was not covered, and I had to fight the insurance company to get you on it. And then I had to do it piecemeal. I can't give you a single pill because your insurance company won't allow me. I have to give you 3 pills to manage what I do with one. So how was it incorporating, this now, in addition to the diagnosis, but taking medicine into your life?
I mean, you literally set up a team for me to meet with all different doctors to handle different ailments that I may have. High blood pressure, cholesterol, kidney disease, HIV. All of those type of medicines have to be able to work in conjunction and not make my kidneys worse, right? And so at one time, I'm literally every day taking probably close to 7 pills, not including any vitamins that I may take. So that's 7 pills in the morning. And although I was much more diligent now in taking the meds, that's where it was a little cumbersome to swallow that many pills and the first thing in the morning. So that definitely was a bit of a challenge of taking all of those, and not to mention of having all of those pills on hand at all times. Meaning, like I couldn't afford to be without one of the pills. I had to make sure that the refills were filled at the same time, and that I had some pills basically to never run out, or have one without the other. I basically had to have 2 of the antiviral pills.
I can remember you went through your chart, and I don't remember you having a lot of side effects. I think the big issue for you was, now I had to be a little more aggressive in making sure you were following with the kidney doctor. And,
Yes.
a little bit of a side, it's 10 years later and you're not on dialysis. Whereas that trajectory you were headed to, you would have been on dialysis. And I think, working with nephrology to control that blood pressure, stop you from putting out so much protein, controlling your HIV really has helped keep you. And we're here now 10 years going, pretty soon to be 11, and you're still not on dialysis, which is a really, really good thing. And, you did really well with pills. I mean, I remember you getting on antiretrovirals, getting undetectable, and pretty much stayed undetectable. And then we eventually were able to get that single pill. But, we had a discussion, and, I think you were very interested in switching to the long-acting injectable. So
yes,
I guess why did you want to switch?
As I said, I was already taking like close to 7 pills, right? And I got tired, not tired. It was starting to get frustrated to be sure that I had the pills exactly. I like to stay up on the new technology. And even with the injectable, I believe you and I may have talked for like a half an hour just about that. And even those in your office, I talked to them about it. And they're like, well, you just get in and you come in every 2 months. It's easy. It's in and out. Don't have to think about it. But also, I think it also gave me a little bit of comfort. Like if I were to travel with my pain meds or going to the doctor to get HIV meds at a pharmacy, if I were to move, I mean, I don't have to tell them anything. I can just come to you to get the injectable once every other month. So it makes it a lot easier for me to come in 15 minutes, half an hour, and I don't see you have to come back again for another 2 months.
Yep. You remember what it was like when you first got the injection? Were you nervous?
Yes, I was very nervous because they had to inject me in my hip. I didn't know where it was. I didn't do my own research on that. I was like, wait, and I think I'm talking to you. Yeah, you just get the shot and you'll be fine. And I'm like, what the hell? I'm like, wait. And then I saw the size of the needles, and then it dawned on me, oh, they're putting literally 2 months worth of medication or antiviral medication into me, right? Um, and the first time, I think even later that day after I got the shot, I just laid down. It was like I could barely move my leg. I don't know if all of that was because of the shot or because of what I built it up to be. Um, but there was pain because they give you so much, and it sits right. I forget what they call it, where they inject it. But that first time it was hard. But after that, I'm in and out now.
And do you feel the pain's gotten better over
Oh,
time?
definitely. Oh, yeah. Even when you first get that, even that first shot, it may have lasted for like the first couple of days because it's something new. Um, and months after that, when I've gone to get the shot, the pain may last the car ride home now.
Yeah, no, I mean, it's really great to have, I think, that option for individuals. It's not for everyone, but it's really nice to be able to say, hey, I have an option for you that's not a pill. Not everybody wants
Right,
a pill. Um,
right.
so, just to sort of wind down a little bit, during all the years you've been taking HIV medication, we talked about this a little. Do you feel your health has changed? And if so, how?
I think I have a way more vested interest in keeping up with my health. And checking and looking at when I leave the doctor's or any doctor's office, and I look at their notes, and I look at the tests that were ordered, whether it be blood tests, urine tests, um, any type of test. I actually look over those and look them up. I'm more in tune with my health than I was prior to meeting you, actually.
I'm going to try to finish up, and I have two questions, and
Mhm.
I think I really
Yeah.
want to hear your thoughts. So, what thoughts do you have looking forward, and what message do you have for any patients who are newly diagnosed, really looking to you for advice on how do they cope with this?
To answer the first part, for anybody that's newly diagnosed, um, take accountability. If prior to this you were not an active participant in your medical history or the treatment, start to become one. Be your own advocate. Uh, but also take it in, digest it. But as you told me, this probably will not be the thing that kills you. You'll probably, if you are have other health concerns, this will not be uh, the end all be all for you. It is no longer a death sentence. I'd like to see where the antiviral medication goes from here. I know I've talked to you and I've looked online. Like if they can have an antiviral medicine that you can come in for every other month, then surely we can go 3 months. Surely we can go 4 months.
That's where the field is going. I
Yeah,
always tell individuals when I talk to them about injectables, this is really the first wave of a long wave to come.
right.
There's a lot more to come. Technology is increasing, and so is the research. So yeah, just hang tight. It's coming.
Yep. And one thing about the injection, uh, and especially for someone that's just starting to take it, uh, although your doctors may be good, look at your testing results. The actual person can actually see if they are still undetectable. Getting the shot, because you want to be mindful of that as well. I think to get the injectable, you have to be 1 week before or 1 week after, but not longer than that. So that's one thing to think about when they're getting, like, take a look at your own test. I do. I look at all of it. And if I have a question, I will surely bring it to you or to anyone. Um, but don't look at it, okay, you can wallow in self-pity for a little bit. Okay. Give yourself a couple days, maybe a week. But after that, there are things that you have to do if you're newly diagnosed. And believe me, if I have the strength to do it, and I'm not just saying it, and I'm not just one of those talking heads or just making up something. I truly had to look within, and even talking to Dr. Short to get a plan in place of how you're going to think about it, how you're going to tell the person, because they have a right to know if they are your significant other. You have to tell them. I'm not just going to say it that way. You have to tell them, just so they can get tested, and whatever their feelings may be after that, be okay with that. Be okay with it. It's not necessarily easy, but be okay with it.
I really appreciate you taking the time to share your insights. I think it's very helpful to hear from the patient perspective. It's really important. It's great to have all this data, but really hearing your point. So thank you again for joining us for this podcast today.
All right. Thank you very much.
Thank you for listening to this episode of Patient Voices in HIV Management. Please go to the activity page on practicepointcme.com to complete the post-test and evaluation to receive continuing education credit.